Did you know that one Canadian is responsible for providing free healthcare to all Canadians? Well, in this short video, we're going to find out who he was, how he did it, and why his legacy lives on today. By 1945, Tommy Douglas had already accomplished quite a lot. He'd become the first Premier of Saskatchewan, ushering in sweeping social reforms like universal health care, a 40-hour, 5-day work week, minimum wage laws, and even an annual minimum income for all Saskatchewan residents. But these reforms were just the tip of the iceberg for this ambitious politician. You see, ever since he was a young boy growing up in the small town of Moose Jaw, Saskatchewan, Tommy had big dreams. He wanted to create a Canada that provided economic security for all of its people. Unfortunately, the reality of Canada in the early 20th century was a far cry from Tommy's dream. The country was still reeling from the Great Depression, with thousands of farmers and laborers struggling to put food on the table. And although Canada had made some progress towards creating a welfare state, like introducing unemployment insurance and old age pensions, these programs were woefully underfunded, leaving the majority of Canadians without a safety net. This didn't sit well with Tommy. After studying political science at the University of Saskatchewan and getting ordained as a Baptist minister, Tommy dedicated his life to fighting for social justice and improving the lives of ordinary Canadians. He joined the Cooperative Commonwealth Federation, or CCF, a left-leaning political party committed to improving the lives of working people. By 1935, at just 34 years old, Tommy was elected Premier of Saskatchewan, becoming the youngest Premier in Canadian history. Premier Douglas wasted no time in implementing his progressive agenda. He introduced minimum wage laws, maximum hour limits, and even a 40-hour, 5-day work week for government employees, all of which were unprecedented in Canada at the time. But Premier Douglas's most significant achievement was the introduction of a universal healthcare system for all Saskatchewan residents. Although the plan was initially met with opposition from the medical establishment, which feared government interference in their profession, as well as from the provincial legislature, which felt that the plan would be too expensive, Tommy pressed on. He believed that access to healthcare was a fundamental right, not a privilege reserved for the wealthy, and he was willing to go to any lengths to make that a reality. After winning a landslide election in 1944, Tommy's political clout had grown significantly, and with it, so had his influence over the medical establishment. In 1946, the Medical Care Act was passed, creating a single-payer healthcare system that covered the entire province. For a monthly fee of $2, Saskatchewan residents gained access to an array of healthcare services, including hospitalization, diagnostic tests, and even prescription drugs. At the time, this was the most comprehensive healthcare reform in the history of North America. And although it faced financial challenges and administrative growing pains, the people of Saskatchewan loved it. By 1966, over 90% of Saskatchewan residents were enrolled in the plan, making it one of the most successful healthcare reforms in the world. Seeing the success of the Saskatchewan plan, other Canadian provinces and the federal government quickly followed suit, eventually creating the Canada Health Act of 1984, which guaranteed all Canadians free access to healthcare. Although Tommy Douglas officially retired from politics in 1971, he continued to be a champion for social justice causes for the rest of his life. He remained active in the CCF, which eventually merged with the NDP, and he continued to speak out against inequality and injustice. He died in 1986 at the age of 77, but his legacy lives on today. Not only did he transform Canadian politics forever, but he also showed us that a more just and equitable world is not only possible, but that it's within our grasp. So next time you head to the hospital or take a prescription drug, remember Tommy Douglas, the man who made it possible. Now, Tommy Douglas wasn't the only person fighting for healthcare reform in Canada. There were many doctors, nurses and activists who also played a key role in making healthcare free for all Canadians. If you want to learn more about the fight for healthcare in Canada, stay tuned for more information. Thanks for watching